Back with you now on your Monday morning. The window is now open for Medicare's annual enrollment period, and starting in January, up to 3 million more Americans will be eligible for additional financial assistance to pay for their prescription drugs. Joining us now to help explain who's eligible and how to get these benefits is Leigh Purvis, AARP Prescription Drug Policy Principal. Leigh, it's good to have you on this morning. Let's just get us up to speed. Who is eligible for these expanded benefits, and how can someone find out if they are?
So Medicare's Extra Help program is available for people who have incomes of under about $22,000 per year, or about $30,000 for a married couple. And it's really important because it helps pay for their premiums and a lot of their out-of-pocket costs. It can result in savings of thousands of dollars. So we really want to make sure that everyone who's eligible is enrolling in the program.
Okay, so under $22,000 for a single, $30,000 for a married couple. What are some common mistakes? I know you see this often. What are some common mistakes that people make when they're signing up during open enrollment? Traps to avoid falling into, and how do we avoid those?
Yeah, my number one recommendation for people when they're looking at a prescription drug plan is to not only look at that premium. It can be sometimes really attractive to take a look at a low premium plan, but you really have to take a look at the big picture. You want to make sure that the plan covers all of your drugs. You want to make sure that your cost sharing is something that you can afford. You want to make sure that your pharmacies are a network. There's a lot of really big, important decisions to make when you're looking at a prescription drug plan. So again, don't just look at that premium, look at the big picture.
And when does this window close? And once it closes, are you can't make any more changes for the upcoming year? How does that work with Medicare?
Right. This is an annual open enrollment period for Medicare, and it's open from October 15th until December 7th. And once it closes, you'll have to wait till the next year for open enrollment unless you qualify for a special enrollment period. So the vast majority of people want to make a decision now.
Okay. Once it closes, you out of luck. Does this new program only help with prescription drugs, or are there any new other perks that come with the new legislation?
There's actually a whole lot to like in this new legislation. AARP was very supportive of it. One really big important change that we're just starting to hear about is that the Medicare program can now negotiate the prices of drugs that cost people a lot of money. So that's going to help bring down costs for everyone. Another really big important change is that there's now an out-of-pocket limit. Previously, you could keep spending thousands of dollars per year, and now people in Medicare prescription drug plans are going to have those costs limited substantially. So that's a really big important change as well.
Yeah, that'll be a game changer for a lot of people, a lot of families for sure. And lastly, Leigh, just any tips for our viewers who are navigating the numerous Medicare choices available that may help them save on their prescriptions? And they're like, Leigh, I don't know where to start. I don't know what to do about this.
A really great place to start is what we like to call the Medicare Plan Finder. It's available on Medicare.gov. You can actually enter your drugs and what you're interested in looking for, and it will help you identify those plans that are available to you. And another really big important thing to look for is your state insurance, health insurance assistance program, or SHIP. It's available at shiphealth.org, and they actually can provide individualized assistance and really help you figure out the best plan for you.
Yeah, a lot of times you got to just talk with somebody and lay out your options, talk about what's best for you and your family. Leigh Purvis, thank you so much for breaking that all down for us. We do appreciate it.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.